Greetings, Board of Directors. Today we are here to talk about the moral right to healthcare. Having a moral right is something that is not a new concept. For centuries, philosophers have studied different methods to understand exactly what those rights are. This has become known as the study of ethics. When talking about morals, we usually think of what is right or wrong based on monetary values. However, when discussing the moral right to health care, we are talking about the correct way to treat those who need proper medical care, quality care, and treatment of their ailments. This is the right of every patient that comes through our hospital doors. We strive to stand by this moral right through various means, by understanding cultural competency, the code of ethics, and ensuring we protect our patients, their privacy, and their well-being. When talking about a code of ethics, one must first remember the very oath physicians agree to uphold when they graduate medical school. It's the Hippocratic Oath. The oath implies a promise of faithfulness, to observe patients' confidentiality, and to have respect for those they are caring for. This promise is upheld in the American Medical Association's Medical Code of Ethics, along with many other principles in which we adhere to in our hospital as well. We work to create strong relationships between all our physicians, staff, and patients by providing them with open communication, options, and any medical information and advice they may need. As mentioned previously, we also strive to uphold patient privacy and confidentiality, not only because it is in our oath, but because it is our ethical obligation to do so. Along with providing care, it should be known where healthcare financing is coming from, that laws such as the Stark Law and False Claims Act that protect against physicians filing false claims are upheld in our facility, and that we are in compliance with those laws, not simply because there are legal repercussions, but because it is the right thing to do and our ethical obligation. It is our duty, as Kantian ethics might suggest, to uphold these ethical principles, because the rightness and wrongness of actions does not depend on their consequence, but on whether they fulfill our duty. While the American Hospital Association gives us a guide to ethical principles we must follow, other ethical guidelines, such as principleless ethics, could be used as a guide in actions to influence our hospital's own unique code. Providing our patients with autonomy or the ability to self-determine their own health care treats them with respect and creates that very format for patient-physician relationships we discussed previously. Non-maleficence means to cause no harm and can encompass a wide variety of suggestive traits. Nevertheless, it is a general duty to cause others no harm and to treat your patients with the respect that they deserve. Beneficence guides us to do good, and that is the principle behind general morals. While one should disassociate moral imperative from their work, creating this will do good serves as a principle to provide curative care to patients and continue to provide the best care possible, even when we may not ultimately agree with the decisions some patients might make about their own care. While justice pertains to fairness, which can be in relation to healthcare costs, allocation of resources, and distribution of goods, it is our job to ensure our patients are given a fair go and that no one is discriminated against. All of these ethical values work in tandem to provide us with our own code of ethics and conduct, which crafts our individual values, vision, and mission. By practicing these values, we are showing understanding and working to provide compassionate care, empathy, honesty, integrity, high quality care, and affordability for our patients. Exuding cultural competence not only shows that we treat others equally, but that we understand who they are, where they've come from, and how it has affected them. Various cultural differences can lead to different diagnoses, and understanding how a certain race, sex, sexual orientation, socioeconomic status, or religion has been affected by certain ailments can help to provide curative measures. It is important, however, to exude no bias. No matter one's personal beliefs, care should be provided for everyone at the highest quality available, and to do that, one must be competent without any personal prejudice or bias. Several times throughout the presentation, privacy and confidentiality has been mentioned. It is our job here to protect our patients and their information. We have laws such as HIPAA, which work to protect personal health information from those who have no need to access it. Sometimes during emergencies it can be quite difficult to uphold these policies, but we must remember that we have to because it is the patient's right to not have their information displayed to those they may not want to know it. This ties into patient respect and privacy. It has to be understood that knowing someone's personal health information is a privilege and it needs to be protected at all costs. Whether that be from simply verifying someone's phone number to asking how a patient is doing with their cancer treatment in the middle of a crowded waiting room. We have to be aware of what type of information we are spreading when we ask certain questions. Ideally, someone's moral right to healthcare encompasses many things. We must remember to remain in compliance with the rules and standards set in place, as this is what showcases our reputation as a healthcare provider to our community. By understanding our code of ethics, knowing the culture and background that we provide services to, as well as protecting our patients' privacy, we can ensure that our organization is one where patients know they will have their needs taken care of. Thank you for your time.